Hello, my name is Dr. Alfiee-Breland Noble. I go by Dr. Alfie. I wear a number of hats. One is a senior scientific advisor for the Steve Fund. I also am the principal director of something called the ACOMA Project, which is a research lab. And I am an associate professor of psychiatry at Georgetown University in Washington, D.C. This idea of people being already on the margins and feeling pushed out to the margins, I think is a really big reason why people don't talk about mental illness and mental health concerns. In some of the research that I did many years ago, we had a young woman who I think articulated it very well. And so this young sister said, I'm already black, I'm already a woman, I don't also need to be crazy. And so I think there's this idea of mental illness being so much more stigmatized and marginalized in communities of color that people do not want that label associated with them because they already feel like they have enough struggles with discrimination, xenophobia, homophobia, some of these other things, that adding a mental illness label on top of that will make their lives that much more difficult. And I think that's a really big reason why we don't talk about these things in our communities. I think what everyone's looking for, I say this all the time, is everybody's looking for their mirrors. They're looking for something that reflects who they are. And different people have different aspects of who they are that are salient for them. So for a young person, it might not be the color of his or her skin, although that's important to that person. It may be that they're non-gender conforming. And so what does that mean, and how does that impact their relationship to people who are gender conforming, to the LGBTQ plus community at large, and to other people of color, and to the majority culture white folks in this country. So there are so many different ways in which we can identify. I think for me, as an African American woman, what's salient for me are both my gender and my racial identity, but that's me. And so for another black woman, she might not even identify as African American, right? She may be Haitian, or she may be Jamaican, or she may be from the Bahamas, or she may be from an African country, and so that might be what's salient for her. So I think that what it's important to recognize, and what I value about what MHA is trying to do, is really trying to give people space to say, this is who I am. I identify it for myself the way that makes me feel comfortable. That's okay. And even within that context, I am able or willing or trying to approach a conversation around mental health that fully encompasses all aspects of who I am. I think one that I try to encourage, I hear this from a lot of black women in particular, where people will say this thing of, I'm too blessed to be stressed. And I was just saying the other day to a big group of folks, what I try to encourage is not to say things like that, because it further marginalizes people. Because if you're a person who is stressed, right, and stress is a term that we use, I think, in many communities of color when we really mean anxious, right? So the stress is like a sort of a coverall for a lot of different kinds of things, but I think one of the primary is anxiety. So when we say things like, I'm too blessed to be stressed, well, what does it mean if you are stressed, or if you are anxious, or if you are a worrier? Does that mean you're not blessed, right? And so it really starts to create distance for people, and I'm thinking particularly of marginalized populations, people of color, where I don't know that that's necessarily the intent or what we want to do. And so I try to encourage people to not say those kinds of things. I think also we don't like to use the clinical terms. So we don't want to tell somebody that we have major depressive disorder, or that we have generalized anxiety disorder. What we'll say is, I just feel shaky all the time, or I'm a worrier. And that's okay, because everybody worries. And so what I try to encourage people to understand is, yes, everybody does worry, but there's a spectrum. And what I want you to be aware of is, where are you on the spectrum? And once you figure, and I don't mean to sort of confuse it with the autism spectrum. What I'm suggesting is that it's almost like a timeline, and you are somewhere on that timeline, or you are somewhere on that line. And what you want to try to do is calibrate so that you understand when what you're dealing with is okay, and when it starts to become maladaptive. And once it starts to become maladaptive and impact your life in negative ways, that's when it's time to seek help. So the one other one that I hear people say a lot is this idea of, I have the blues. What does that mean? What does that mean, you have the blues? Describe that. And when I hear people unpack that, what they're talking about is depressive illness. So we want to help people find a language that they can live with. Maybe everybody doesn't want an MDD label, a major depressive disorder label, or a depressive illness label. But we want to find a language that allows people to name what they're dealing with, but that also encourages them to seek help. What I always try to tell, I work a lot with young people, middle and high school students, teenagers, and college students. where I always try to start with young people is I say to them, you are valuable because you're here. You don't need to do anything. You don't need to be anything. You don't need to say anything. You don't need to look a certain way. You are valuable because you're here. And with that, I want you to stay here. So if there are things that are pulling at you that may take you away from here, so that we don't get to enjoy the pleasure of your presence or just your company, I want you to get help for that. And then that gives me an opportunity to say, here are some of the kinds of things that can take you away from here. They can take you away from your authentic self and who you were put on this earth to be. And that gives me an opportunity to get into things like talking about signs and symptoms of depression, talking about signs and symptoms of anxiety, helping them name and put a label on what they've been experiencing and feeling. And then I have an opening to say, there's help for this. You don't have to struggle like this. It is not okay to continually be racked with worry, to continually be racked with guilt. You can live another way. And so what I always want people to know, more than anything, is that you're valuable, you're loved, you're wanted, and the best way for us to have the opportunity to love you, value you, and want you is for you to be here. So whatever is going to pull away from that and put you in a space where we don't get to love you and value you and want you, I want you to get help for that. Thank you, Mental Health America, and thank you for the work that you do, America. And I am just so grateful to have the opportunity to talk with you, and I'm wishing everybody optimal mental health.